Hello, my name is Dr. Elizabeth Tapscott, and I am a history professor here at Lindsey Wilson College. My area of expertise is early modern Europe, a time and a place that experienced a lot of turmoil and crisis, very similar to what we are experiencing in our own world today. And so for that reason, I'm going to talk to you about plague, fire, and catastrophe, leading through some of history's most challenging moments. We've heard a lot in the recently about these, over the last few months about these unprecedented times. However, these times that we're experiencing are far, far, far from unprecedented. For the overwhelming majority of human existence, what we have been experiencing, social and political unrest coupled with a major, major health crisis, was just daily life for the overwhelming majority of the world's population. It's only in the last 100 years or so that this potent combination of unrest and health crisis could be considered unusual in the first world. It is still the order of the day for large parts of the world. Also, what most of us in the first world at least, have been experiencing, masking, social distancing, limiting our contacts, the disruptions to our usual schedules and routines, is a mild inconvenience compared to the experiences of those who lived through past pandemics and plagues. But the details of that are for another lecture. I don't say these things to downplay the seriousness of COVID-19 or to disregard what we are currently experiencing and those that we have lost, but to offer some much needed perspective. Things could be worse. So much worse. And that is precisely why we need to continue to follow the guidelines. One thing the study of the past will teach you is that pandemics are not over simply because we want them to be. They are over when they are over. And that always takes time. Lots of time. Often years. We can learn so much about navigating our own troubled times by looking to the leaders of the past and how they guided their communities through some of history's more challenging moments. And so I'm going to focus on four leaders in their times of crisis. The first leader I want to talk about is Martin Luther, and he faced the plague in 1527. In 1346 to 1353, the plague, also known as the Black Death, killed between 75 and 200 million people in Africa, Europe, and Asia. Let that number sink in. The Black Death in the 14th century, right, in 1346 to 1353, killed an estimated 200 million people in Africa, Europe, and Asia. It killed 30 million people in Europe alone. It wiped out whole communities. After 1353, there would be outbreaks of plague every few years throughout Europe. It would pop up in one region, have a flare-up in another, etc. Now, never again really on that massive scale of 1346 to 1353, but still, people knew it and lived in absolute fear of it because it was still literally a plague that stalked the earth. So when an outbreak of the Black Death hit the German lands in 1527, Martin Luther, the founder of Protestant Christianity and a leader within his own local community, knew he needed to act quickly to protect his people. What he does is he encourages them to listen to the experts, to take their medicine, and to avoid contact with others. He says in a letter to a colleague, if one makes no use of intelligence, the word of experts, or takes no medicine when he could, when he could do so without detriment to his neighbor, such a person injures his body and commits a crime in the eyes of God. It is even more shameful for a person to pay no heed to his own body, and fail to protect it against the plague as best he is able, and then to infect and poison others who might have remained alive if he had just taken care of his own body as he should have. He is thus responsible before God for his neighbor's death and is a murderer many times over. Therefore, Luther says, I shall ask God to mercifully protect us, but then I shall fumigate, help purify the air. I shall administer medicine. I shall take it. I shall avoid places and persons where my presence is not needed in order to not become contaminated and thus, perchance, to infect and contaminate others, and so cause their death as a result of my negligence. If God should wish to take me, he will surely find me, and I have done what he has expected of me, and so therefore am not responsible for either my own death or the deaths of others. According to Luther, following the guidelines laid out by the experts to take your medicine, to avoid contact with others, to limit your contacts, to social distance, is not only to protect yourself, but more importantly, to protect others, and, according to Luther, spare you from God's judgment. In times of crisis, a leader listens to the experts. In times of crisis, a leader listens to the experts and encourages their people to listen to the experts, even if those guidelines are not popular. King Charles II of Great Britain was no stranger to plague. In 1665, the Black Death tore through London, killing around 100,000 people in a matter of 18 months. 100,000 people in a matter of 18 months in one city. Many expected the king to flee to a safer location, but Charles insisted on staying in order to be with his people and to be an example to his people. In early September of 1666, just when the plague was beginning to abate, a fire broke out that threatened to destroy the entire city. This is known as the Great Fire of London. After days of struggle, they managed to contain the blaze. Among those fighting the fire are King Charles and his brother, the Duke of York. At a time when monarchs distanced themselves from the struggles of their people, most would have fled both the plague and the fire. Charles and his brother James, the king and the heir to the throne, are literally hauling buckets, wielding axes, and fighting the fire, putting their own lives in danger, fighting the fire alongside the people of London. In a time of crisis, a leader gets their hands dirty and works alongside their people. He or she does not ask them to do what they are not willing to do themselves. On December 6th, 1917, two ships collided in the harbor of Halifax, Nova Scotia, in Canada. World War I was still raging in Europe, and the ships were carrying munitions and ordnance destined for the Allies. So when they collided, they created the largest man-made explosion in history to that date. Over 2,000 people died almost instantaneously. Hundreds more were severely injured. Parts of the city were completely leveled, and it was in the middle of an intense Canadian winter. Those who survived were exposed to the elements and potential for even further death and destruction. Word quickly reached Boston, 400 miles away. And Massachusetts Governor Samuel McCall immediately dispatched a train full of supplies and medical personnel without even waiting for Halifax's answer to his offer for assistance. He had telegraphed them and said, we are coming to help you. Anything we have is yours. Anything we can do will be done. More supplies and more healthcare workers were sent on subsequent trains. Many stayed in Halifax for months, even years following the disaster, to continue providing relief. And here's the kicker. Not only was Halifax not in Governor McCall's state of Massachusetts, Halifax, Nova Scotia wasn't even in the United States. It is in a foreign country. It is Canada, right? It's not even the same country. We are coming to help you. Anything that we have is yours. Anything we can do will be done. In times of crisis, a leader takes decisive action to help, immediately decisive action to help, and gives freely of their resources, even when the people who are in need are not their own. This brings me to our own historic moment that we are living through. Last March, the CDC and the National Institute of Health didn't have to look far to find a precedent for these so-called unprecedented times, right? They didn't have to look far to find a precedent for our own current situation. The influenza pandemic of 1918 to 1920 served as a prime precedent for our own experience. In 1918 to 1920, the influenza infected up to 500 million people worldwide and killed up to 100 million people worldwide. Those are absolutely catastrophic numbers. But the guidelines put in place during the pandemic, especially the wearing of masks, was instrumental in keeping those numbers from being even more catastrophic. Check out the guidelines from November of 1918 that are sort of on to the left of your the right of your screen there. I'll read them out to you because my little box is sort of hiding some of them. Wear a mask. Live a clean and healthy life. Bathe frequently. Live in an abundance of fresh air. In other words, be outside. Keep warm. Get plenty of sleep. Gargle frequently with salt water. Report early symptoms to a doctor at once. Respect quarantine regulations. Avoid crowds. Avoid persons who sneeze or cough. Wear a clean mask. Do not disregard the advice of a specialist just because you do not understand. Do not disregard the rights of a community. Obey the rules issued by the authorities. Do not think that you are entitled to special privileges. Do not go near other people if you have a cold or fever. You may expose them to influenza and death. Instead, see a doctor immediately. Do not think that it is impossible for you to get or transmit the influenza. Keep your hands out of your mouth. Do not cough or sneeze out in the open. Do not visit the sick. These should all sound very familiar, apart from gargling salt water, because these guidelines have been proven time and time and time again to work. They saved countless lives in 1918 to 1920, and this is a fact that the CDC, the National Institute of Health, and the World Health Organization all recognized, and they have therefore been saving countless lives in the past 13 months around the world. In times of crisis, a leader learns from the lessons of the past. Chances are, your unprecedented situation isn't so unprecedented after all. We don't need to constantly be reinventing the wheel or starting from scratch to come up with a solution. Turns out, a solution from 100 years ago applies to our situation as well. We can learn so much from those who came before us, who experienced major crises, who led in the midst of major crises. In times of a crisis, a leader listens to the experts. In times of crisis, a leader gets their hands dirty. In times of crisis, a leader takes decisive action to help. And in times of crisis, a leader learns from the past. There can be a serious degree of comfort also in knowing that what we're experiencing is far from unprecedented. We are not alone in facing the uncertainties of these strange times. Thank you.